Hey everybody, my name is Dr. Daniel Choi, board certified periodontist since 2011. Over the years, I've actually had a lot of comments from my viewers asking me what my thoughts were about all on four versus 3-on-6. So I actually have that video currently in progress right now, but in the meantime, I do want to come up with some commentary in regards to like what my thoughts are from this other guy who did a video basically about the same topic, all on four versus 3-on-6 or P1 versus FP3. So I've never actually seen this video before, but let's go ahead and watch this and I'll give you my thoughts. All right, let's get started here. I'm going to speed them up a little bit.
Hey everyone, how are you doing? My name's Gus. I'm an implant dentist and cosmetic dentist based around London in the UK. And today I want to look at something which a couple of our viewers on this channel have mentioned, and that is the comparison between a 3-on-6 implant system and an all-on-4 implant system. Okay, so just to bring everyone up to date, both of these solutions are designed for people who have got no teeth or they're in a situation where they've got very bad teeth and they will need to be removed. An all-on-4 kind of system, okay, and I'm going to say kind of system because all-on-4 is a specific product made by Nobel Biocare, which is a really well-established implant company. So an all-on-4 kind of system.
I want to pause that for a second and just let you know, these are coined terms. So all-on-4 is just a system that was named by an implant company called Nobel Biocare, just like you mentioned. And then 3-on-6 is basically a proprietary name also for a different type of system. Now, people might still do these types of procedures, but call it different because many different variations. But these, like, these FP1 implant type bridges, like a 3-on-6, people will call it most commonly from what I see on YouTube 3-on-6 because that's what they most synonymously know them as. Like back in the day, people will call Kleenex tissues, or back in the day, because I'm old enough, like people will call, like a Sony, like the TV, right? So people get a synonymous name with it, but we'll continue here.
You typically take 4 implants and you put 2 at the front, 2 at the back, and the back ones are angled. Okay, so I'll explain why they're angled in a minute. And then on 4 implants, you have a full set of teeth made. Now, typically, this full set of teeth has gum on it, fake gum. Okay, so your natural gum is flat and is higher up, it's higher than your lip is covering. And then you have the fake gum, which is a little bit visible, and then you have your teeth on there. Okay, and this, in my opinion, has a lot of advantages doing it like that. The 3-on-6 system is slightly different. So you would have 6 implants placed for the full set of teeth. And then on those 6 implants, you then have 3 individual bridges made. Okay, and on their website, they've got a lovely diagram explaining how this is done. But one of their unique selling points is that there is no fake gum. Okay, so I'll come on to why I think this is a bit of an issue in a minute.
I like the fact that he's saying that why this is going to be an issue, because I 100% completely agree, and I want to hear him out.
Both of these are products, okay, and both of these are examples of people trying to productize a treatment, right, a medical treatment. Typically, what would happen is, you have a problem, or somebody has a problem, they come in to see someone who can fix that problem. So if I had a leaking pipe, I'll call a plumber who would come in, look at the problem, diagnose it, see why it's leaking, see what the problem with the system is, and then take corrective steps to fix that, okay? But here, what's kind of happening, and this is a general trend in medicine, is that people are self-diagnosing at home and then thinking, oh, you know what, I really need this all-on-4 treatment or this 3-on-6 treatment. Then they go online and they find an all-on-4 or 3-on-6 provider. And this can be a little bit dangerous because I would say about 2 people who come to see me every month, not in lockdown, obviously, but yeah, they come to see me and they're convinced that they want to have all-on-4 treatment. And they generally dislike it when I say, actually, you know what, we can save what you've got. But that aside, right, the whole thinking behind an all-on-4 or...
With what he just said, I would actually totally agree with. And I do see similarly, it's kind of interesting that people will do their research. And, again, 3-on-6 is what we call FP1. And I'm going to be talking about that in my next video. So you guys will see that linked ahead in the future. But 3-on-6 is an FP1 type of solution. All-on-4 is an FP3 type of solution. We are going to try to do the ideal solution for you. And for each case, every patient, whether their anatomy, what their smile line looks like, their teeth, all these little factors come into play that make you a better candidate for one or the other. So when a patient does research online and falls in love with one type of solution, sometimes that can be like a bad idea because, and the other thing is like, if you don't have a dentist that's in your best interest, they could actually send you down that road of what you want, but that might not be the best solution for you. But let me keep hearing him out.
Or the 3-on-6 is nothing new, okay? These are treatment possibilities which have been around for a very long time. But what these companies have done is just put a label on it and selling it as their own thing, okay? So the 3-on-6 having implant bridges has been done for forever and a day. And all they've done here is said, okay, you know what? Instead of having one long bridge, let's make 3 separate bridges, okay? And their website is very pretty. It really explains the process pretty well. They don't have that many before and afters. Okay, they got a couple because nobody would sign up if there was no before and afters. You have to sell the dream on the website. And they say, the process, I'm going to go through the process. And there's some elements here which I do strongly agree with, which are really, really good. Okay, have a consultation first of all, that makes sense. Have the implant surgery, at which point you will have a removable denture, okay, as a temporary measure. So this is a key difference. With the all-in-4, typically you don't walk out with a removable denture while the implants are healing. Okay, but they say if it's suitable, you can have a full arch temporary bridge, which is what you would walk out with an all-in-4 treatment. Okay, and then they say step 3.
So what he did talk about, like a denture, if you end up getting a denture for an, whether, you're very few minority of the cases of an all-in-4 after the surgery, you have to wear a denture. Very, very minority, and that's typically if you have very soft bone. But, when he was also talking about 3-on-6, you may end up with the denture. Like that denture, I always tell my patients because, even snap-on denture patients, they would have to wear a regular denture during the healing period of like 4 months at least. I tell patients, because I'm always trying to like decrease expectations during that time, you're going to hate us because that denture is a nightmare for you to deal with. And in fact, most people don't even want to wear it during that healing period. So wearing a denture during the healing period is a huge disadvantage.
Okay, and then they say step 3 is they'll make what I call in my clinic a trial smile. So a smile made out of temporary materials, which I 100% recommend. This is a really good way of doing it. And then once you're happy with the aesthetics and the bite, you have it processed in porcelain. Okay, and that's where you make the 3 porcelain bridges. Then you have the final bridges made. Then, if we scroll down to the features part of the website, and these features tables, right, they're so common. You'll see them on so many websites. My biggest problem is the questions which they ask are heavily skewed towards the system that they're trying to promote. Okay, so here is... if you look at the all-in-4 column versus the 3-on-6 column, you'll see they're very similar, okay? But it says here that the 3-on-6 never needs to be removed by a dentist, okay? I would completely disagree with this. If I've got a patient who's got a bridge, an implant bridge, okay, especially if it's a screw-retained implant bridge, which is easy to remove, and all the all-in-4 ones are all screw-retained, then I would recommend removing it, inspecting the implants periodically, maybe once a year, once 2 years, and then putting it back. Okay, so even if you've got 3 individual bridges, I would still recommend to remove it and have it. And then feels and functions like natural teeth. No implant is going to feel exactly like a natural tooth. There's a couple of very, I wouldn't say big differences, okay? Because the patients who have all-in-4, they say that, it all feels really nice and feels really natural. And I assume that the people who have the 3-on-6 or whatever you're selling, full arch implant system, they're going to say that it feels natural because it will feel much more natural than the situation that they've just come out of. But natural teeth have a little ligament, they've got a little bit of movement, whereas implants have no movement, they're solidly anchored into bone. Okay, they say that it's smaller and thinner as well. Again, I would disagree with this. The all-in-4 bar with all of the teeth on it can be made to be very, very thin and pretty much as thin as as a bridge on it.
Let me pause it right there. I do agree with this last point. If a all-in-4 with the implants are placed in the correct position with the correct what we call timing, and then also the multi-unit abutment is properly selected and also chosen the correct timing, then a all-in-4 can be extremely thin profile also. So I agree with them. But if it's not properly done, then an all-in-4 can be bulkier and a 3-on-6 can be slimmer. Now, again, that's not necessarily true either, because if the 3-on-6 implants aren't placed in specific spots where the restoration is not going to be proper, then your speech and aesthetics and your lip profile, all these things can be affected, which can then, if we try to correct, we'll add more bulk. And I know a lot of this sounds confusing. Again, it's going to be illustrated in my next video. Then, long story short, 3-on-6 placement of the implants can be more unpredictable, meaning it's going to be definitely more difficult. And that is a thing that a lot of patients need to understand. The complexity increases significantly when you're trying to do a FP1 implant bridges 3-on-6 type of solution. Let's continue.
Implants, which, again, we do that quite a lot in the right kind of situation. And then, they don't give any idea on pricing. They've got all this stuff, all these questions, which they answer the FAQs at the bottom. And it says the all-on-4 is a larger, bulkier thing, feels unnatural. I would completely disagree with this. For all the patients who we do this for, we make it as thin as possible. And I've never had a patient complain that the final set of teeth is too thick. Okay, they do. Sometimes patients will complain that the temporaries feel thick and they interfere with speech and things like that. That's normal because the temporaries are made from plastic. Plastic needs to be thick.
So I do both types of solutions. Well, I don't do 3-on-6 because 3-on-6 is a proprietary name. They want you to get their own training at their institution. And again, I don't want to speak negatively about them, but if it's just FP1s, which is what it is, the individual implant bridges, we do those also. So we do both solutions, and I agree with what he's saying. Like, I feel like from a marketing standpoint, there's a lot of attack if people are trying to favor 3-on-6. There's a lot of attack for all-on-4. Whenever you find improperly done all-on-4s or clinicians who just don't care or are inexperienced, if they are placing the implants in improper places or improper angles or timing and improper use of multi-unit abutments, then you are going to end up with a ill-fitting prosthesis, which is going to be bulkier and feel less natural. So I 100% agree with him. But if you know what you're doing, we see we're doing all-on-4s, whether once or twice a day. I saw a patient yesterday that traveled from out of state. I saw her yesterday in her milled temporaries, and they looked just like as a normal implant bridge, nice and slim profile, which is going to be extremely favorable for the patient's experience to make it as lifelike as possible. So as long as you know what you're doing, my bottom line is I agree with him. If you have a lot of experience doing these things, then you're going to have a great result. If not, then you could have some of the issues that 3-on-6 is claiming that all-on-4 patients do have. So again, you got to be careful who you choose as your provider.
Give it a little bit of strength. Okay, so the system seems suitable. Okay, and I would always judge a system on, does it transform the patient's life? Okay, really, it doesn't matter what brand or what you have. I would always say have good quality implants, but it doesn't matter whether you go with 3-on-6 or all-on-4, whatever. As long as it transforms your life and it takes you from a position where you're not able to eat, or you feel really self-conscious about the way your teeth look, and it takes you from there and takes you to a place where you feel really great about your smile. You don't need to worry about covering it up. You can eat whatever you want, and when you go to a restaurant, okay, it doesn't matter whether you have 3-on-6 or all-on-4 or whatever it is. My slight issue with this system is the fact that they advocate no gums. Okay, now the reason for this is I'm coming very much from an aesthetic background. Okay, and in order to create a beautiful smile, one of the key things that we have to get right is how much top tooth is on show when the patient is talking. Okay, so we can judge this. Sometimes we'll ask the patient to say the letter M and let their lips just rest, and then we take a photo, and then we take a measurement of that, the amount of tooth. Okay, so that dictates how long the teeth should be. And then we have what we call our height-width ratio. So the width of a central incisor, the front tooth right in the middle, the biggest one, the width of it should be about 75 to 80% of the height of the tooth. Okay, and then once you've got all the teeth in position, the height is typically about 11 millimeters. So that dictates how high the tooth should be. Okay, so remember, on the 3-on-6, all you've got is the teeth sitting on gum. Now, when you have teeth removed, you lose gum, okay, which means your implants have to be placed higher up. And not only do you lose gum, you definitely lose what we call the papillae. The papillae is the pink triangles between gums. Every single full arch case, which I've seen done without any pink gum, has always compromised the aesthetics, because to minimize this pink triangle, which is what you have to do. You have to flatten the gums really to make it look okay. What they do is make the teeth look more square. Okay, so in between each tooth, you have a contact area. Now that contact area, or a contact point as it is in perfect.
Okay, so I understand what he's talking about, but the problem is I think he's getting pretty deep in the weeds here, and it's going to become, you know, if I'm an average patient who barely knows what he's talking about, but I think what he's basically trying to get to is that your shape of your gums, like, you know, a lot of people when they're thinking about aesthetics are thinking about like, you know, if I want crowns or veneers, they think that it's just getting a set of teeth that's going to make your smile beautiful, and they can do that for you. But, you know, your bone in your gums, because your bone affects your gums, and how, you know, again, your peaks of gums between your teeth, what we call the papilla, if those are affected at all, which is going to happen during the extraction process, then you are going to have a compromised aesthetic result. Unless you're an older person who has a very low lip line, when they smile, that you barely see like a few like centimeters of their teeth. But if you're a person that smiles, and when you laugh or smile and you see any bit of gum, then your aesthetics can be severely compromised by an FP1 implant bridge 3-on-6 type of solution, right? So I think basically that's what he's getting at. And I'm in my next video, I'm going to talk specifically about this, and actually I'll have some drawings for you. But that's basically where he's getting at.
Point as it is in perfect health. It needs to be about 5 millimeters from the gum. Okay, and then we know we're going to get this sort of pink triangle filling. But if you don't have any teeth there, then that distance becomes a lot smaller, which means if you have 2 implants next to each other, it's going to be very difficult to get that pink gum looking natural there. So what you do is you make the teeth look more rectangular than oval, and that will hide this pink triangle below the lips. Okay, so if you look at all of the all-on-6 photos that we've got here, none of the cases will show that pink gum. Okay, and that is important because sometimes when my patients laugh, you know, freely, not just smile, but really laugh, you can see that high up. And from an aesthetic point of view, I always think it's nice to get that looking really good as well. Okay,
I want to like basically elaborate on this. We've had even also a lot of elderly men patients who are like in their 60s, 70s, and they say, listen, I just want to be able to chew again. And it's not even necessarily like a confidence thing that they're even like looking to get. But it's funny because when you get them towards their finals, like temporaries, so that they can like, you know, right before they go to their final set of teeth, they suddenly start evaluating every little aesthetic thing. And why I use this as an example, because like people who say that they're not even aesthetically motivated in the beginning, like in the end, they want everything to look good. And it makes sense, right? I use this as an example all the time. No one's going to sit there and say, some people may say, listen, I want to buy a car. I want to get a method of transportation. But then when it push comes to shove and you buy that car, how happy are you going to be if you get a dented lime green car? You know, in an ideal world, you're going to be like, well, you know, ideally I would want the color that I want, and I don't want it to be dented. So that's kind of like what we see in regards to like these types of cases. So if we are setting expectations for patients in regards to like, hey, you know, like in the end, if we do choose an FP1 implant bridge 3-on-6 type of solution, and you have a higher smile line, lip line, and I can see the papilla or any sort of gum on your teeth. And when we take these teeth out, and if these implants are not exactly perfect and there's no bone loss or like any sort of trauma during the extraction process, then we may have a compromised aesthetic result. Are you okay with that? And then so a lot of patients will tell you no, of course. So I think that patients need to be told about all the cons that can happen with like an FP1, again, implant bridge or 3-on-6 type of solution.
Okay, and the best way that we found to do that is to add gum onto the teeth.
Therefore, give you an all-on-4. And the reason why he's saying that is because during the extraction process, or if you've had bone loss in your life, or if you had gum disease, you're going to lose that bone and therefore lose some of that gum, and therefore give you a compromised aesthetic result. So the view that he's coming from is basically your aesthetics, and he mentioned this at the beginning of the video. He's more of an aesthetically, you know, driven, practicing dentist, which is great. He's looking out for your future aesthetics. He's saying, I think he's leading right into this, that all-on-4 is probably going to be a better solution for you because it's more predictable, and I would 100% agree with that. And again, I do both types of options.
One system's better than the other. You know, I don't even use all-on-4. In fact, I did a bit of research on this 3-on-6 thing, and they actually use the same implants that I use 80 to 90% of the time. Okay, so there's no problems in the types of implants which I use here. There's no problems with the overall results, right? If it transforms the patient's life, that's excellent. I do have a slight issue with productizing dentistry like this, okay, because it's now a case where patients call up, and this has happened with orthodontics, with the Invisalign and things. Patients call up saying, hey, look, can I have all on four? Can I have 3 on 6? Or do you do 3 on 6? Do you do all on four? There used to be a time where it would be like, okay, look, I've got this problem. What are my options? How can I fix this? Okay, and that's kind of the way that I still work. And I know that I put off a couple of patients every month who come in wanting all on four, and I know there's a better way. So I tell them that. So they hear my opinion, but very few of those.
Okay, so that's interesting to know, because just a second ago I thought he does all on four, but he doesn't do all on four. But it's good to know.
Those guys actually come back for treatment. Okay, so I hope this has been useful. If you've got questions, comments, you can always put them below. I do read all the comments, and I try to respond to as many as I can. Okay, so until next time, take care. Hey guys, okay, so I recorded the whole video and I forgot to mention the issue with the very back implant. So the reason on an all-on-4 kind of treatment, the back implants are angled forward. So the top ones are tipped forward like that, and the lower ones, instead of being straight down, are tipped forward like that. The reason for doing this is to avoid things like the air sinus at the top. Okay, so when you lose all of your teeth, your air sinus expands, and in order to get your teeth as far back as possible, the back implants need to be tilted forward. Now, you can have implants going straight up, but you need to have what we call a sinus lift done first to do that. So I assume that with this 3-on-6, they're either using a sinus lift or maybe even something called a pterygoid implant, which is an implant which goes much further back. On the lower jaw, there's the nerve which we need to avoid. Okay, so there's a nerve which runs inside the middle of the jawbone. It goes all the way down. It comes out around here, kind of like midpoint, where your corner of your lip is, comes out there. So again, with the all-on-4, we're angling the implant, so the bottom of the implant forward, so that we're avoiding this nerve. Now, if you want to put your implants further back, sometimes you can do it if there's still enough bone there, but you need to use much shorter implants to do that. So again, I'm just comparing and contrasting this 3-on-6 versus the all-on-4. All right, take care.
Okay, so it's interesting because then it pops up some of his next videos, and I guess he does do all on four. So in the last 4 years, I guess he is doing all on four. So yeah, I agree with a lot of the stuff he says. I do agree is that there is productizing of a lot of systems, and because it gets people to think that things are proprietary to their way. It is, they did reinvent the implant bridge with the 3-on-6 process. I think one of the things that he didn't mention is that when you do 3 individual bridges, you are losing cross-arch stabilization, because if it's all one actual unit, due to the physics of it, you can actually decrease the stress on each individual implant, which is to the benefit of the implant over the long haul. But obviously, again, I don't know 100% everything about 3-on-6 because I didn't go to their proprietary training. But I'm sure, I've also heard that some people now will do one single arch, which would not really make that 3 individual bridges, right? So I'm not exactly sure about how they do things with that, but in general, I agree with a lot of stuff. I'm going to try to come up with a very, very, very detailed yet understandable concept with the differences that I see between all-on-4 and 3-on-6. Again, that would be all-on-4 is FP3 versus 3-on-6, which is FP1. I'll come up and let you know about the differences between those two in a detailed and understandable way, so that whatever option you decide to choose, you could be as educated about the process, because there could be some, hidden things or, some lurking challenges that could exist later on. And we want to make sure that you are as aware of all the, the things that could happen, right? So make sure you stay tuned, and I will be putting up that video next. All right, thanks.